Hello, students. My name is Dr. Butts.
And I'm Dr. Stuff.
We're Team Butts and Stuff.
Today we're going to talk to you about the respiratory system. What is the respiratory system, you might ask? Well, I'm going to tell you. The respiratory system is made up of your nose, your mouth, your pharynx, larynx, trachea, lungs, bronchi, and alveoli. Now, your respiratory tract is divided into two sections, the upper and the lower tract. Your upper tract contains the nose, the mouth, the pharynx, and the larynx. And your lower tract is going to contain your trachea, bronchi, alveoli, and of course, your lungs.
The human respiratory system begins with the nasal cavity. This is where air enters the system. Then it travels down the pharynx. The pharynx extends from the skull to the esophagus and is a passageway for both air and food. Then comes the larynx. It is located between the pharynx and the trachea. The thyroid cartilage makes up a portion of this box-like structure, and the epiglottis is the lid. Next is the trachea, which is anterior or in front of the esophagus and extends from the larynx to the level of about T5. From there it divides into the right and left main bronchi. This bifurcation is called the carina. The trachea is not collapsible because of the cartilage that makes up the walls.
Good point. So, your right bronchus is shorter, wider, and more vertical than the left, making it easier to aspirate into your right lung. Each one enters your lung medially at the hilum. As soon as the main bronchi enter your lungs, they divide into bronchi that go into each lobe of your lung. These lobular bronchi, in turn, branch into the bronchi that go into each segment of each of the lobes. These segmental bronchi continue branching until bronchioles are formed. From these, the alveoli are formed, which are the functional units for gas exchange. So, your lungs. They are cone-shaped organs that fill the thoracic cavity. They are separated by the mediastinum, and both lungs should extend from the diaphragm to just above the clavicles or your apices. Each of the lungs are divided into lobes by what we call fissures. And your right lung has 3 lobes and 2 fissures, and your left has 2 lobes and 1 fissure. Your lungs are encased in a double-walled serous membrane sac called the pleura.
As stated before, the pharynx acts as a passageway for both air and food. The larynx is used for sound production and the prevention of liquids and solids from entering into the trachea. Both the trachea and the bronchi are used to provide a pathway for air into the lungs. All of these parts on their own perform, but as a whole, their purpose is to oxygenate the body. Next, we'll show you a functional model of the lungs.
So these are your lungs. So you're going to breathe in. Air is going to enter and travel down to your lungs, and your diaphragm is going to expand, allowing your lungs to fill with air. And then, when you exhale, your diaphragm contracts and your lungs deflate, and this is ventilation. By the way, I meant to ask you, do you use mane and tail for your hair?
Yes, I do.
So the respiratory system as a whole takes in oxygen to the body and rids it of carbon dioxide. To carry out this function, air must be moved from the atmosphere to the terminal units of the lungs called alveoli. And this makes ventilation happen.
Next, we're going to delve into pathology, namely lung cancer. Every year, more than 200,000 people are diagnosed with lung cancer. It kills more people than colon, breast, and prostate cancer. Lung cancer is more common in men than in women, lucky us, and also in black men, 20% are more likely than white men to get it. Early diagnosis and treatment are important for survival.
So if your doctor thinks that you may have lung cancer, they're probably going to have a chest x-ray done to confirm their diagnosis. On a chest x-ray of someone with lung cancer, there's usually a visible mass or nodule that will appear white, and the lungs may appear black. However, an x-ray may not be able to detect all forms of cancer, like small lesions. In this case, a CT scan can be used to detect those earlier forms. This scan takes a cross-sectional and a more detailed image of the lungs. Lesions are small abnormal areas in the lungs that may be cancerous and are easier to detect on a CT scan. When doing an x-ray on someone with lung cancer, usually the exam will consist of a PA and a lateral chest x-ray, unless otherwise stated, and technique does not need to be altered for this exam.
Now, there are 2 types of lung cancer, non-small cell and small cell. Then there are tumors in the lungs, which are called carcinoids.
Non-small cell lung cancer is the most common type of lung cancer and makes up about 85% of cases. There are 3 subcategories: squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. And these cancers have 4 stages. Stage 1, the cancer is only in the lungs. Stage 2, the cancer is in the lungs and the nearby lymph nodes. Stage 3, the cancer is in the lungs, the lymph nodes, and the middle of the chest. Stage 4, the most advanced stage of all of them, the cancer has spread to both lungs, the fluid around the lungs, and possibly to other parts of the body like the liver. This type of cancer usually occurs in the airways or the outer parts of the lungs and is a slower growing cancer.
Next on the small cell lung cancer. It makes up about 10 to 15% of the lung cancers. This type of lung cancer is typically found in the bronchi and tends to spread quickly. It's very invasive. It is more so a result from smoking than its non-small cell. There are 2 stages, limited and extensive. In the limited stage, cancer is found on one side of the chest, involving one part of the lung and nearby lymph nodes. In the extensive stage, the cancer has spread to other regions of the chest and even other parts of the body. Keep on. Tumors. Fewer than 5% of lung cancers are lung carcinoid tumors. Most of these tumors grow slowly and rarely spread. These tumors are not caused by smoking. The tumor is typically located in the bronchi and in the bronchioles. They are made up of special cells called neuroendocrine cells.
So, we have an x-ray for you of a woman in her mid-40s who has been diagnosed with lung cancer. As you can see, she has a mass or nodule in her lungs. This is lung cancer. And it's hard to tell on the lateral picture, but on her PA radiograph, it's easy to see that the mass is indeed in the bronchiole or the airways of her lungs, thus making it a non-small cell type of cancer.
Very good job on that.
Lung cancer symptoms. There are few, if any, symptoms in the beginning, which is terrible. As it progresses, the person may have a cough that persists, have breathing problems such as shortness of breath, wheezing, or chest pains. And in more serious cases, they could be coughing up blood or have sudden unexplained weight loss. However, these don't usually surface until it's too late. Causes of lung cancer. The number 1 leading cause of lung cancer is smoking, so don't do it. Secondhand smoke also contributes to lung cancer, as does exposure to asbestos and radon exposure and those good old family genes. So, thank your parents.
Next, you may ask, what can I do if I get lung cancer? There's treatment options for this.
Tell me.
Surgery, chemotherapy, and radiation treatments.
And now we have a visual for you of someone who does have lung cancer. So here we have the nasal cavity, which in turn turns into the pharynx and the larynx. Then your trachea, and at the bifurcation where your bronchus entered the lungs. They then in turn turn into bronchi, which then in turn turn into bronchioles. And at the end of those are your alveoli, the functional unit of gas exchange in the lungs. And as you can see, he or she does have lung cancer.
This concludes our presentation for today. And as always, spay and neuter your pets, and there were no animals harmed in the production of this video.